Hi, Dr. Chan. I have a lot of patients that are from out of town, and so we usually end up doing our 1 month follow up by phone. And sometimes our phone conversations are not always remembered. And so I decided to do this video trying to go over all the usual things that I go over in this visit. And it is not my intention that this video replaces the 1 month visit or phone call. Rather, this acts as a supplement to help retain some of the things that we discuss at that 1 month mark. So, one of the first things that we talk about is the scar management. So, at this point, we no longer worry about the scars doing bad things like getting infected or opening up. So, it is all about the scar quality going forward. So, I want patients to start some form of scar therapy. I leave the ultimate choice to the patient. Essentially, most people follow one of two categories of scar therapy. Some people believe in lotions and oils and creams, and certainly if you've had good experience in the past and you want to use them, I'm perfectly fine with that. My only request is that if for whatever reason you don't like it, rather than discontinuing the entire SCAR program, that you try something else. And we want some type of SCAR therapy to continue until the end point, which is the flat white scars. The other group is the silicone patches. Now, I know a lot of people are concerned about the word silicone in this product, but it is on the external skin, whereas implants were inside the body. So that's the main difference. Certainly, you don't worry about what your jewelry, socks, shoes, pants are made of because they're rubbing against the outer skin. And I think it's sort of the same thing. There is no chemicals or medicines. That's not the mechanism, as evidenced by we use the same patch again and again and again until they no longer stick. So it's more of a compression phenomenon. And if you go to a burn hospital or clinic where people with bad burn scars are treated, every garment they wear over those areas are lined with silicone patches. So it's a compression issue. Patients that do not tolerate this product have tape allergy. Because this product has to stick, those with allergies to adhesives do not tolerate this product. I usually advocate using this product at nighttime. So you peel off the sticky backing, put it on the scar, and you take them off in the morning and just reuse the same one again and again until they no longer stick. And once you're done with them, and for most people that's between 6 to 8 weeks, you have a choice to make at that point. You can continue with another set, or at that point you can move on to some type of a cream, lotion, oil that you might have read something about and you want to try on. At this point, the scar is well healed, so we no longer worry about them submerging underwater. So taking a bath, going for a swim, going in the water is acceptable. At this point, I no longer have bra restrictions. You can use whatever bras that you find comfortable. Finally, at 1 month, all the physical restrictions come off. You can resume activities, exercises, lifting, doing chores around the house. But you have to remember there are a lot of fresh, abnormal scar tissues in your chest area. You can't try to pick up where you left off. You have to start at low levels, light weights, light intensity, rather than having a preconceived schedule in your head. You're advancing based on how your body feels after trying certain things. So you try some things you haven't done in a while, it feels great, you can do more. You try some things that you thought would be really easy, and yet your body lets you know that it's not comfortable, you just back off. And following that rule, most people will take another month or so before they're fully back to normal. And following that rule, you're not likely to get into any kind of trouble. And the last thing to remember is there's still a lot of healing going on. There is excessive amount of energy being used in your breast areas. So especially as your activity level ramps up, you're going to find that fatigue is still a significant component of your recovery process. It is not a sign that things are going backwards. It is just all part of the healing process. So don't get discouraged. So I hope that helps. Again, this is meant to be used as a supplement for our usual 1 month conversation. Thank you.